good news is we are all getting older and overall living longer. But the bad news is that we are taking multiple medications to stay well. And it is very difficult to understand all the medications that we have to be on. And with that idea, we started this Institute of Therapeutic Innovations and Outcomes to improve health outcomes and improve quality of life.
The advantages of having a ITIO that can test a program like our medication management program is that we can see what types of manipulations within the program result in better care, and we can move quickly to implement those differences.
The medication management program is the first program to fall underneath the ITIO.
It was just me, her, and a technician in a small room in the college, and we'd call people whenever I'd come in after class. We'd call people from all over the country and talk about their medicines.
When we first started, we were doing about 50 patients a week, to give you an idea, with that staff of 3. With our current staff size, we do around 500 medication reviews a week with patients. In 2015, we're projected to do around 40,000 medication reviews. It is unique in that it's telephonic team medicine. We call patients all over the country and review their medications. So it really becomes kind of a collaboration between the doctor, us, and then the community pharmacy the patient's working with, as well as case managers.
There are some unique advantages of telephonic medication management. Number one, you can reach so many more patients by telephone. When we call them at home, we ask them to look at everything they're taking. When they come to pharmacy, they're only coming there to pick up their med.
I think it's a completely different way of pharmacy, because when everybody thinks of a pharmacist, they think of somebody that counts the pills.
I always thought it was going to be strange that I might miss that patient interaction. If I'm on the phone, it's, you're not seeing them, but you can really visualize almost the person in the home.
We're talking to them about their medications, we're helping them solve their problems, we're being an extra resource.
Where they're telling me, I have noticed the last couple of days my blood sugar gets down in the 40s and the 50s, and I didn't want to tell anyone about it because I didn't want to bother them. And those are things that, when we catch, it's exciting that we've discovered this before they end up, non-responsive and end up in the hospital.
The IT platform that we utilize is a really innovative electronic medical record that takes the claims data and identifies interventions off of those claims data. So it will run the medications through the clinical algorithms and identify the drug-drug interactions, the safety issues, and then help us triage patients appropriately.
Having information alone is only part of the solution. The major part is interpretation and resolution.
We've got a great software that will make sure that we're not missing anything, but I have the freedom to really evaluate that patient's understanding of their medicines.
The patient was a caregiver for his wife, and he was having a hard time communicating with his doctor, and he goes, "Would you mind calling and talking to my doctor and just help me out to make sure she's taking the right medicine, because I don't want her to end up in the hospital with a stroke again."
And there's so many days that we leave here and I can think, oh my gosh, I made such a difference in that lady's life. Or my intern really found something amazing that if we hadn't called that person today, no one would have gotten a hold of them.
We have to give them both an understanding of today's practice, but also the cutting-edge practices of tomorrow. We take as part of our responsibility as the college is to be sure that our graduates are able to handle the changes in healthcare delivery that pharmacy is going to see and undergo over the next 40 years of their practice lives.
So when we hire students on, we have a set training model, how to discuss adherence with patients, how to pull information about their medications. Then they do shadowing with our current interns and technicians. And then once they're on the phone by themselves, we continue to monitor them and have the pharmacist check them.
There's a lot of resources we have in the current healthcare system that we're not really utilizing to their full potential, and pharmacists are a great example of that.
Are we going to need more people who can deliver care and more mechanisms that they deliver care by, including telephonic mechanisms? I think the answer is yes.
I think Dr. Nahata is a visionary, and I think that he's a champion for our program. Without his vision and support, I don't think we would have been able to launch this year.
Where do we go from here? I think this is a prototype of the program that applies to a variety of different populations of any ages. Anybody who's taking a medication. It only can get bigger because it serves the mission of a university in a beautiful way. From patient care to teaching to research and outreach. It's a service to the community. I believe it's a game changer.